Good morning. My name is Bobby Harris. Leadership in healthcare and public health isn't an abstract concept. It shows up in outcomes, safety, and trust. From Stockdale's early trait studies in 1948 and 1974 to Bass's work on transformational leadership in 1990, research has given us a clear truth. The best leaders match their approach to the environments they lead. Today, I'll share 5 styles with you: transformational, inclusive, servant, authentic, and adaptive. For each, we'll look at their characteristics, strengths, and challenges, and where they work best. Along the way, I'll connect the theory to the realities of 5 sectors of our public health and healthcare domain. We'll explore these leadership styles through 5 areas: healthcare administration, clinical healthcare, healthcare business operations, healthcare information technology, and public health. By pairing the right style with the right context, we can move beyond just managing systems to transforming systems. So let's start with a style that's almost synonymous with change: transformational leadership. Bass describes this as inspiring people to see shared vision, challenging them intellectually, and modeling the way forward. The core characteristics: intellectual stimulation, individualized consideration, inspirational motivation, and idealized influence. It's powerful. Nedler and Tushman found that it raises performance and morale in complex systems, but Judge warns that burnout can occur quickly when change is too constant. It also relies heavily on charisma, which can be overutilized. Where does it best fit? Healthcare administration, driving quality improvement where compliance dominates. In business operations, pushing efficiency without losing engagement. And in public health campaigns, rallying diverse stakeholders behind a shared cause. And while transformation sets the direction, it's often most effective when paired with a style that ensures everyone has a seat at the table. And that brings us to inclusive leadership. Bennis and Manis frame inclusive leadership as curiosity-driven, bias-aware, and collaborative, with courage and cultural intelligence at its core. Zuccaro found that inclusion improves decision quality and legitimacy with stakeholders. The strengths are clear. When people feel heard, they invest more fully. But there are challenges. Elmhurst University noted that inclusivity can slow decision-making and meet resistance when those uncomfortable with equity change and equity work are engaged in it. It's best suited for healthcare administration, shaping fair, transparent resource allocation. Public health, in co-creating policies with communities. Health IT, involving diverse users to catch design flaws early on. Inclusivity ensures voices are heard, but listening deeply to those voices and acting on their behalf is where the next style really excels. That's servant leadership. As Greenleaf envisioned and Nordhaus expanded, servant leadership flips the leadership model. The leader serves the people first. Key characteristics include listening, empathy, foresight, stewardship, and building community. It's a natural fit for healthcare. World Health Organization and the Institute of Medicine emphasize patient-centered care and trust as drivers of outcomes. Its strengths lie in building resilient teams and trust-filled relationships, but without boundaries, it can be perceived as permissive or even exploited. So where does it thrive? Clinical healthcare, aligning patient values and shared decision-making. Business operations, balancing efficiency with staff well-being. And health IT, ensuring technology truly supports its users. Serving is powerful, but to serve effectively, leaders must be grounded in who they are and willing to be transparent about it. That's where authentic leadership comes in. Described by Zelznick and detailed by Nordhaus. Authentic leaders are self-aware, guided by internal moral perspectives, transparent, and balanced in their decision-making. Its strengths: credibility and trust, especially in moments of uncertainty. The challenges: overfocus on relationships can slow urgent action, and difficulty adapting if personal values conflict with organizational needs. It's best suited for clinical healthcare, where high-stakes care decisions require candor. Public health, where we need transparent crisis communication, which earns public trust. And finally, administration, creating fairness and integrity that change the whole landscape of change management. And when the challenge isn't just interpersonal, but systemic, requiring a flexibility in the face of shifting conditions, leaders need to employ a different set of skills entirely. Enter adaptive leadership. Hype's model, again adapted by Nordhaus, is built on complexity and ambiguity. Characteristics include diagnosing systems, regulating stress, maintaining disciplined attention, empowering others, and protecting voices from the margins. The strengths: it navigates evolving challenges and fosters resilience. The challenges: it's slower and can frustrate those used to top-down, fast answers. It does, however, fit well in health IT, managing interoperability, cybersecurity, and AI oversight. In public health, coordinating multi-agency responses in unpredictable crises. And in operations, redesigning entrenched workflows where incentives, not just processes, must change. When leaders adapt, they enable systems to adapt with them. When we map these styles to our sectors, a pattern begins to emerge. Administration and operations, transformational and inclusion, anchored by servant to keep people at the center of the entire thing. Clinical, servant and authentic, balancing compassion and transparency. Health IT, adaptive and servant, ensuring systems are both functional and user-friendly. And finally, public health, authentic, inclusive, and servant, combining trust, diversity, and service. As Zakaro reminds us, leadership effectiveness is contextual. In healthcare, especially in healthcare leadership, it's a clinical requirement. Match the style to the situation, protect the people while you're driving performance, and always ground your decisions in evidence.